Good morning. Thank you very much for joining us today. I'm Scott Harris. I'm the State Health Officer, and I'm joined on the podium today by Director Brian Hastings of the Alabama Emergency Management Agency and by Dr. Don Williamson, former State Health Officer and currently President of the Alabama Hospital Association. We appreciate you taking the time to join us today. We wanted to take a few minutes to talk to you about the coronavirus situation, what's occurring in America and in Alabama, and we also wanted to let you know what we're doing in Alabama to prepare for the possibility that we may have coronavirus cases at some point in our state. I'll start by saying that we do not have coronavirus infections in our state at this time. We have not identified any infections in the people that we have monitored or tested. There have been rumors, as you know, fueled by social media in many cases that we have cases, but we do not. At this point, Alabama has not identified any coronavirus cases. We have been in almost constant contact with CDC over the past 6 to 7 weeks. We speak to them daily and usually several times daily. We're certainly aware that there are cases of some community transmission in some parts of the United States. We understand that that's very concerning to folks in our state. People who live in Alabama are worried about what might happen and want to know what they should do. And so we scheduled this press conference today just to try to answer questions and to let people know the best information that we have and try to communicate to each person who has a question what they can do to protect themselves and to protect their family. At ADPH, our mission is to protect the health and safety of all Alabamians. It's a mission we take very seriously. We have an agency with well-trained professionals who have a lot of experience in dealing with this, and we're very confident that we have a good plan going forward to keep our state safe. We have been working since mid-January on primarily prevention activities, but also at the same time, we have been in a planning stage for the possibility that we will begin to see the virus circulating at some point in our state. We stood up our incident command system, and what that means is we activated a group of people with sort of an all-hands-on-deck approach in mid-January, and that brings everyone together from our agency and with other partners outside the agency who work together on coming up with a strong plan to deal with the situation as it develops. This is a situation that has changed really rapidly. There's a lot of new information coming in every day from different parts of the world. Sometimes the messages get a little bit confused because things do change so rapidly. But we have been working very hard with the providers in our community, with doctors, other providers, to make sure that they have the most up-to-date education and information on how to evaluate patients and how to test patients. We have been working very closely with our hospitals, and I know Dr. Williamson will address that in a few minutes. Our hospitals have done a terrific job of preparing for this, and we feel like that they are well prepared in case we should have a transmission in our community. We've helped to provide guidance for our emergency medical services, for EMTs and paramedics. We're reaching out to our nursing homes. We provided guidance already to our schools, our colleges and universities, as well as kindergartens and daycares, just to make sure that they understand how best to prevent infections in those institutions and facilities, and also to think about what they might do if cases were to show up at some point. We also have provided some guidance for businesses. There are many businesses in Alabama that have travelers who work for them or involved in business travel. We have airlines that have air crews that continue to travel now to parts of the world where there might be disease transmission. So we're working very closely with these employee health organizations within those groups to make sure that people are given the best advice and learn how to take care of themselves and protect themselves, and to make sure that public health is aware of what's going on with them. So far in Alabama, we have monitored over 100 people who have returned to the state from China. As you know, CDC is funneling all air travelers from China through 11 U.S. airports. And so we receive notices daily or sometimes several times daily of people returning to our state that we need to be aware of. We have reached out to these folks who are returning and educated them, encouraged them to practice self-monitoring, and encourage them to practice what we call social distancing, which involves staying at home, staying away from large groups of people, and monitoring their own health. These returnees check their temperature multiple times a day. We check in with them every day. And now most of those people that we've been monitoring, we have finished their monitoring. They've completed 14 days of monitoring, and we are no longer have a need to follow them. We do still continue to follow a few of them. We've had a small number of people, less than 10 people, who had some type of symptoms that prompted us to test them for coronavirus. All the coronavirus tests that we have ordered are negative. We have all the tests back at this point on all the people that have been tested. We have no more outstanding tests at this time that we're awaiting results on. So we feel very comfortable at this time to say that we don't have the disease circulating in our community. Remember that there are over 60 countries that have reported cases. There are almost 90,000 people in the world have reported infections that we know about, but the disease is still not widely circulating in the United States at this time. There are some episodes of community transmission that you have undoubtedly seen in the press on the West Coast and in the Northeast, but at this time, this is not a high risk for people who live in Alabama. We will continue to monitor. Situations can change quickly, but at this time, we do not see a highly elevated level of risk for people in our state. I would finally ask you to remember what you can do to prevent coronavirus transmission. In many ways, this is exactly the same advice that we give out every year during flu season. The way we prevent these type of respiratory transmitted diseases from spreading is to, first of all, use good hygiene. Wash your hands frequently. Avoid touching your eyes and nose and mouth with your hands unless you've washed carefully. We would encourage you to cover your cough or sneeze if you have a cough or a sneeze. Stay away from people who are ill. If you know that people who are ill, then do your best to try to avoid that situation. And I can't stress this enough, but if you yourself are sick, please stay home. Please don't try to work through an illness. Don't try to go to work or go to school, but stay home until you're well enough to get back out in public. That's all the prepared comments I had right now. I'm going to turn it over at this time to Dr. Don Williamson from the Alabama Hospital Association.
Scott, thank you. Let me first start by thanking the Alabama Department of Public Health for working with our hospitals to keep us in the information loop and helping us to remain prepared. Now, let me point out to start with that emergency preparedness and responses are not new. Our hospitals have emergency preparedness plans that they exercise on a regular basis. We have developed processes to screen and to isolate individuals who present to the hospitals meeting the CDC criteria for the virus. In addition, we're working to ensure that the employees of our hospitals that will be essential in response are adequately trained and prepared so that they don't risk acquiring infection. Hospitals treat patients with infectious diseases on a daily basis. These patients are isolated, they're treated in appropriate spaces by trained personnel, and when there is a threat of a disease that could cause a surge of patients, each individual hospital steps up its preparedness and coordination activities. Hospitals share best practices, and they also deploy specific strategies that will work best in their facilities and to contain any outbreak. Much remains unknown about COVID-19. But a clearer picture is emerging, and hospitals are refining their responses regularly based on that additional information. What do we know now? We now know that most people who become infected with COVID-19 will not become seriously ill and will therefore not need hospitalization. However, we are able to quantify bed availability in near real time and to implement surge plans to increase available beds should that become necessary. Those systems have been well tested in previous hurricanes and during previous flu seasons. I would just close again by thanking the Alabama Department of Public Health and by reiterating the comments that Dr. Harris made. It is still flu season. If you've not been vaccinated, be vaccinated. Not that it will protect you against COVID-19, but because it will lessen the confusion if you develop a flu-like illness. Practice hand washing. Don't touch your face with your hands. Surgical masks are only effective for people who are symptomatic to try to prevent spread from them. N95 masks are only effective if they're properly fitted, so masks really have no place for the general public in trying to control exposure. So again, thank you, and stand by to answer any questions.
Thanks for the invite today, Dr. Harris. My name is Director Brian Hastings. I'm the director of the Alabama Emergency Management Agency, and I'm thankful for this time just to talk about a couple of points that I wanted to bring up. First of all, the Alabama Emergency Management Agency is not the medical or public health lead. Dr. Scott Harris and his team at Alabama Department of Public Health are the medical and public health leads in Alabama. The Alabama Emergency Management Agency is the lead coordinator for requests and response across the state and outside of the state to the state of Alabama and assistance from the federal government. So we are here to support the Alabama Department of Public Health and our public health officer, Scott Harris, in the Alabama activities to make sure that we respond and recover from the COVID-19 outbreak. We're very fortunate, like Dr. Harris said, that we don't have any cases here. And as our speakers have already said, we've had some experience with this in the past. So this is a very serious situation, but it shouldn't be filled with a lot of fear. We need to make sure that we're thinking through this and looking at the facts. We've done this before with pandemic influenza. We've seen it with some Zika, and we've also done it with Ebola here in Alabama. So we can't forget what we've done in the past. It's time to kind of recreate those good habits that have kept Alabama healthy over the years. I'd like to reiterate that not only is the flu good for reducing the confusion, but if we are vaccinating ourselves and staying healthy, then we're also not using resources that could be dedicated and prioritized to the COVID-19 outbreak. The other thing is worth repeating, and it's so hard to do, is that there are two people who will make the difference in a disease containment exercise or an execution of a disease containment plan. It's you and everyone else around you. So if you or the people around you are unwilling to wash their hands, practice good personal hygiene, cover your cough, don't touch your face, if you do those things, you need to wash your hands, you need to sanitize your workspaces once in a while. Good personal, professional, and social hygiene is key. And if you're feeling sick, go to the doctor. And if people around you are sick, don't hang out with them. Practice social isolation and social distancing when you need to, and I think that will help Alabama stay healthy through this episode. Thank you very much. I appreciate it. Thanks, Scott.
Thank you. Be happy to answer any questions at this time if we have any.
Nationally, there's been a conversation over the weekend about the testing, the lack of access to testing. Can you walk us through Alabama's availability to testing and how that's being done across the state?
Sure, absolutely. So for those of you who couldn't hear, the question was about testing for coronavirus. Alabama has received tests from CDC. We received them recently, and as you may recall, at the national level, there were some questions about quality control, and it appears that not to get into technical of an explanation, but it appears that there was really just a single reagent problem with a single part of the test, and we have now received the go-ahead to begin using those tests that we have received. We're in the process of training our staff and doing that now and making sure our quality control is correct in the way it should be, and so we expect to be testing very soon. I don't know exactly, but we have the test and are actively training and should be doing that promptly.
For those at home, if they've come in contact with someone who's traveled to an area that may be on the map with this outbreak, do they need to be tested, or do you need to wait until you have symptoms to be tested?
Yeah. The best guidance that we have right now is that people coming from parts of the world where there may be a disease need to self-monitor. We have tried to coordinate our message very closely with businesses, with schools, and with others who are seeing these travelers. And there's a lot of good information that we try to make sure these people get and understand about how they can practice social distancing, how they can monitor themselves for illness, and there's no need at all for them to be tested without symptoms at all. Even in the case that they have symptoms, we would certainly ask them to contact their healthcare provider or to contact us, and we can provide more information about that. But at this time, most of those people are not likely going to need testing. Other questions?
Dr. Harris, we have a few via email. When it comes to disinfectants, like the Clorox and Lysol wipes that we use, This individual wants to know, are those beneficial when it comes to killing the bacteria associated with COVID-19?
Yeah, the question has to do with appropriate disinfectants to use for the virus that causes COVID-19. This is a new virus, and so we can't say for certain. However, there is a lot of experience with coronaviruses, and routine disinfectants do appear to be effective in almost all cases. CDC actually on their website has really extensive information for cleaning crews or people that are doing disinfecting of healthcare facilities or workspaces. And I'll be glad to refer you to that link once we finish here today. We can get back with that person. But it's actually very standard cleaning techniques. There are no real special disinfectants that are required to the best of our knowledge.
And what is the status, if we know, of a vaccine for the virus?
The question has to do with the status of a vaccine. I actually just returned from a meeting with CDC people over the past few days. There is good progress being made in developing a vaccine. It's possible that it can be tested on people in the next 2 to 3 months, probably not before that, although that's actually an amazingly fast turnaround time when we think about vaccines for other diseases. The best information I have received is that it still might be a year or more before it would be widely available for people, so it's not going to be imminent, although again I would say even having a vaccine in a year for a disease we didn't know about 4 months ago is pretty remarkable.
Okay.
Yes.
Williamson, could you talk a little bit about how the hospitals are preparing? We know the nurses union on the West Coast came out with a pretty strong statement this weekend. How can we avoid that in Alabama?
Well, again, hospitals, this isn't, as you've heard, this isn't the first time we've done this. H1N1 was a pandemic. Fortunately, it turned out to be a very low death rate. But so right now, you've got to prepare your workforce. I mean, in Italy, one of the challenges they're facing in Italy is that 10% of their healthcare workers are infected. So that reduces the number of people able to provide care. So making sure that your frontline personnel are trained on personal protective equipment so that they don't get infected. Then you've got to set aside separate rooms in the hospital and try to funnel people who may be at risk through a single point of entry, through a single point of screening into those rooms so that appropriate testing and triage can occur. And then for those small number of people who end up needing to be hospitalized, it's about putting them in appropriate isolation, using appropriate personal protective equipment to minimize spread in the healthcare facility and to minimize spread to the healthcare workers. I mean, one of the most important things, I think, going forward is going to be to protect the healthcare workforce so that they are there and available to provide care. That's why inappropriate use of masks becomes so problematic. We've got to keep that personal protective equipment available to the healthcare workforce so that we can protect them, so that we don't find ourselves with healthcare workers inappropriately exposed. At this point, you know, we've got plans. We work those plans on an annual basis. We've got surge capacity. We've got surge plans that we can increase beds. We can, working with public health and with the Emergency Management Agency, we can move ventilators or respirators should that be necessary. Right now, there's obviously no reason to even consider that, but we have the capacity to respond if we need to. Again, as Dr. Harris has pointed out, social distancing to buy us time for good antivirals becomes extremely important in this setting.
Further questions? All right, if there are no further questions, again, let me thank you for joining us today. The message that we would like the people of Alabama to understand is that we understand the concerns that you have. We feel that Alabama is prepared to deal with this. We will continue our prevention activities, and if we see disease in our community, we'll be ready to respond to that. Thank you very much for joining us today.